All right, welcome to the deep dive. Today we're tackling a topic that honestly sounds pretty scary right off the bat. Canine Parvovirus. Most people just call it parvo. If you've got a dog, or maybe you're thinking about getting one, or perhaps you're even just starting out in veterinary medicine, well, understanding this disease is absolutely critical.
It really is.
It's serious, no doubt, especially for puppies, but it is something we can get a handle on.
Absolutely. Parvo is, well, it's one of those diseases that can just be devastating for a family and their new puppy very quickly.
Yeah.
But the good news, and there is good news, is that with the right information, the right proactive steps, it's largely preventable.
That's exactly it. And our goal in this deep dive, we want to take everything the experts have learned about this virus, how it works, how it spreads, how vets try to beat it, and really translate it for you.
Make it make sense.
Yeah, think of it as your essential guide, whether you're a worried new pet parent or a student trying to grasp the fundamentals of a major canine illness. We're going to try and cut through some of the jargon.
Okay, let's jump in.
So let's start simple. What exactly is Canine Parvovirus at its heart?
Okay, so at its core, it's a highly contagious virus, and it primarily attacks the digestive system in dogs.
Right.
But don't let simple fool you. This virus is anything but. It's what we call a non-enveloped virus.
Meaning
Meaning it doesn't have that delicate, fatty outer coat some viruses have, and that makes it incredibly tough, like really resistant to environmental changes, temperature shifts, even a lot of standard cleaners. It's a survivor.
So tough little invader is a pretty good description then.
It really is, yeah. And while we're not 100% sure on the exact origin, the main theory is it actually evolved from a similar virus in cats, feline panleukopenia virus.
Interesting connection.
Yeah. And there are different strains out there now, like CPV2B, CPV2C. But for you listening, the key thing is they pretty much cause the same severe disease. And thankfully, our current vaccines cover the common ones.
Okay, so we've got this incredibly resilient virus. How does it actually spread? How does a dog pick it up? Is it like doggy colds, sneezing?
No, not really
No.
sneezing or slobber. It spreads mainly through the feces, the poop of infected dogs.
Okay.
And here's where it gets really, really tricky. Dogs actually start shedding the virus in their poop within maybe 4 or 5 days of being exposed. Often before they even look sick at all.
Wait, before symptoms?
Before symptoms show up, and they keep shedding it all through their illness, and for about 10 to 14 days after they've seemingly recovered and gone home.
Wow, so they can look perfectly fine but still be contagious. That's sneaky.
Extremely sneaky. And you don't need to see, like, obvious piles of poop for exposure to happen. Direct contact with a sick dog is one way, sure.
But not the only way.
Not at all. Indirect contact is incredibly common through contaminated objects what vets call fomites.
Fomites, right. Like,
Think food and water bowls, toys, leashes, bedding, kennel surfaces, concrete runs, even grass in the park. And a huge one.
Yeah.
People. We can easily carry it on our hands, our shoes, our clothes after touching a sick dog or just being in a contaminated area.
So that classic scenario,
Yeah.
you walk your perfectly healthy, vaccinated adult dog. Maybe you step in something tiny you don't even notice on the sidewalk. You come home, and your new unvaccinated puppy sniffs your shoe. That could be enough.
That could absolutely be enough. That's a perfect and unfortunately really common example of how it spreads indirectly.
Wow.
And add to that the toughness we mentioned. This virus can survive indoors for months at room temperature. Outdoors, if it's protected from direct sun and drying out, it can hang around for many months, potentially even a year or longer in the right shady, damp conditions.
A year.
Yeah.
Just waiting. That's kind of terrifying.
It is intense.
Yeah.
And it explains why it's so widespread, Parks, shelters, vet clinics, even with really good cleaning boarding kennels, contaminated yards. It's a persistent environmental threat.
Okay, so it's tough, it's sneaky, it hangs around forever. Are all dogs equally likely to get sick if they're exposed?
Good question. While technically any unvaccinated dog can contract parvo, young dogs are by far the most susceptible and tend to get the most severely ill.
Young meaning?
We're primarily talking puppies between about 6 weeks and 6 months old, especially if they haven't finished their full vaccine series or haven't had any shots at all.
What about older dogs?
Unvaccinated adult dogs can definitely still get it, though often the disease might be less severe than what we see in puppies. Interestingly, some studies suggest that intact male dogs over 6 months might be slightly more prone than intact females, but vaccination status is way more important.
And are there certain breeds that people should be maybe extra vigilant about?
Yes, there are some breeds often listed as potentially being at a higher risk for more severe disease or maybe needing a slightly adjusted vaccine schedule to ensure protection. Breeds like Rottweilers, Doberman Pinschers, American Pit Bull Terriers, English Springer Spaniels, German Shepherds, they often come up in discussions.
But the key is vaccination for everyone.
Absolutely. The key takeaway is that vaccination is the #1 defense for all breeds, period. Other factors can worsen things too, like stress thinking, overcrowding, poor nutrition, or having other gut problems like parasites. Those can make the illness more severe if a dog does get infected.
Let's dig into that puppy vulnerability a bit more, that 6-week to 6-month window. Why is that so dangerous?
Yeah, it's all about immunity. When puppies are really young, they get protective antibodies from their mother's first milk, the colostrum. We call these maternal antibodies.
Like a temporary shield from mom?
Exactly. A shield against things like parvo. But these maternal antibodies don't last forever. As the puppy grows, usually around 6 to 12 weeks of age, the level of these antibodies starts to decrease. They wane.
Okay, so the shield is lowering.
Right. Now, the puppy's own immune system needs to start building protection. That's what vaccines do. They stimulate that. But here's the tricky part.
Uh-oh.
If there are still enough maternal antibodies floating around, they can actually block or neutralize the vaccine virus before it gets a chance to work properly.
So mom's protection interferes with the vaccine?
It can, yes. So you get this window of susceptibility. It's a period where the maternal antibodies might be too low to protect the puppy if it meets the real parvovirus out in the world, but still high enough to potentially interfere with the vaccine taking effect.
The puppy's caught in the middle, temporarily unprotected, while its own system needs to ramp up.
Precisely.
Yeah.
And that's exactly why puppies need a series of vaccines, not just one shot.
Right, the booster.
Exactly. Each shot in the series, usually given every 2-4 weeks, is timed hoping to catch the puppy after those maternal antibodies have dropped low enough not to interfere, but before they encounter the real virus. We keep going until the puppy's at least 16 weeks old, sometimes even a bit older in high-risk situations, so we're confident mom's antibodies are gone and the vaccine has had a clear chance to stimulate immunity.
Plus, their own immune systems are just less developed too, right?
Definitely. They're just less equipped to handle a major viral assault compared to a healthy adult dog.
Okay, so let's follow the virus. It gets past the defenses in one of these vulnerable puppies. You said it attacks rapidly dividing cells. Let's unpack that a bit. What happens inside?
Right. So the virus usually gets in through the mouth or nose. Its first stop is often lymphoid tissue in the throat area, think tonsils, nearby lymph nodes. It sets up a sort of base camp there to replicate.
Okay, base camp established. Then what? Where does it go?
From there, it hitches a ride in the bloodstream, and it's specifically looking for cells in the body that are dividing really quickly.
Like construction sites in the body.
That's a great analogy. Places where lots of new cells are being built constantly. The virus targets these spots because rapidly dividing cells are easier for it to hijack and use their machinery to make more copies of itself.
So this tiny virus is like a demolition crew hitting the busiest construction sites. Where are the main targets?
Yes, exactly. The primary targets, the main construction sites Parvo hits, are the cells lining the small intestine, the cells inside the bone marrow, and other lymphoid tissues throughout the body, like the thymus gland.
And what kind of damage does this demolition crew actually cause in those areas?
It's devastating, really. In the intestines, it basically wipes out the cells lining the gut wall, the villi. These are the cells that absorb nutrients and water.
So they can't eat or drink properly.
They can't absorb anything.
Yeah.
This leads to massive fluid loss, hence the severe vomiting and diarrhea. But maybe even worse, it destroys the barrier between the gut contents and the rest of the body.
Oh.
Yeah. So bacteria that normally live harmlessly inside the intestine can now leak across that damaged barrier and get into the bloodstream. That causes sepsis, a massive body-wide infection.
Okay, that's the gut. What about the bone marrow and lymphoid tissue?
There, it destroys the cells responsible for making white blood cells, especially lymphocytes and neutrophils. These are the immune system soldiers.
The ones needed to fight that sepsis.
Exactly. So their production gets shut down, the dog becomes severely immunocompromised, their white blood cell count plummets. They have almost no ability to fight off that bacterial invasion coming from their own gut. It's a double whammy.
Wow. Gut destroyed, immune system crippled.
Pretty much.
Yeah.
And just quickly, in very young puppies, under maybe 8 weeks, it can sometimes also infect heart muscle cells. This can cause myocarditis, inflammation of the heart, leading to heart failure. It's less common now, largely thanks to moms being vaccinated, but it can happen.
That is a lot happening internally. So flipping back to the outside view, for a pet owner, what are the signs? How would you know your dog might have parvo?
Okay, signs usually pop up about 5 to 7 days after infection, though it can range from 2 to 14 days. Initially, it might just be subtle things.
Like what?
Your puppy might just seem off, a bit quiet, maybe not interested in food, maybe a little lethargic, perhaps a slight fever, kind of vague stuff.
Okay, vague start, but then it gets worse, right?
Oh, yeah. Typically within about 24 to 48 hours of those first vague signs, the really classic severe symptoms hit. And these are the big red flags.
Which are?
Severe vomiting, often projectile, and very foul-smelling diarrhea. The diarrhea is really characteristic. It often has this distinct awful odor. It can be watery or have mucus, and very frequently it contains obvious blood.
Foul-smelling, bloody diarrhea, and severe vomiting. Okay, that sounds unmistakable.
Generally, yes. And because they're losing so much fluid so quickly from both ends, they become severely dehydrated very fast.
You'd see other signs, too.
Definitely. Profound depression, just lying there, no energy. They might seem painful in their belly. Gums might look pale or muddy because of the dehydration and shock. In really severe cases, their body temperature can drop dangerously low, or they might collapse. And tragically, without treatment, rapid death within 48-72 hours is common.
So those key signs, vomiting, that awful bloody diarrhea. If you see that, especially in a young dog, what's the absolute first step? No waiting around.
Absolutely no waiting. Call your veterinarian immediately, right away. And when you call, make sure you tell them you suspect parvo.
Why tell them on the phone?
Because they need to prepare. They'll give you instructions on how to arrive safely, maybe have you wait in the car initially, and they'll get their isolation area ready before you bring the potentially infectious dog inside. It helps protect other vulnerable pets in the clinic. Time is absolutely critical with this disease.
Okay, you get to the vet, they've taken precautions. How do they actually confirm, yes, this is parvo?
Well, the suspicion is usually pretty high just based on the dog's age, their vaccination history or lack thereof, and those really characteristic clinical signs. But for confirmation, the go-to is usually a quick test done right there in the clinic. It's an ELISA test, often called a SNAP test. It's done on a fecal sample and looks for the viral antigen, basically bits of the virus, in the poop.
How long does that take?
Usually just about 10, maybe 15 minutes to get a result. Pretty fast.
Is that test foolproof? Always right?
It's generally quite reliable, but like any test, it has limitations. You could get a false negative.
Meaning it says no, but it's actually yes?
Exactly.
Yeah.
That can happen if you test really early, before the dog is shedding a ton of virus, or maybe later in the disease when shedding decreases. Sometimes really watery diarrhea can dilute the sample too much.
Okay. What about the other way? False positives?
That can happen too, though it's less common. The main reason for a false positive is if the puppy recently received a modified live parvo vaccine, usually within the last, say, 4 to 10 days. The test might just be picking up the vaccine virus particles.
Good to know. So what else helps the vet pin it down?
A blood test, specifically a complete blood count or CBC, is often really helpful. Finding a very low white blood cell count, that leukopenia, especially low neutrophils, neutropenia that we talked about.
Because the virus attacks the bone marrow.
Precisely. Seeing that low white count strongly supports a parvo diagnosis, especially alongside the symptoms and a positive SMP test, or even if the SMP was negative but everything else fits. There are more sensitive lab tests, like PCR on the feces, that are more accurate, but those take longer to get results back.
All right, diagnosis confirmed. Puppy has parvo. Now the big one, treatment. He said it's tough. Can the vet give them like a magic bullet, an antiviral drug to kill it?
Unfortunately, no. That's the hard truth. There is no specific drug, no magic pill or injection that directly kills the parvovirus once it's established inside the dog.
Okay. Wow. So if you can't kill the virus directly, what do vets do? How do they save these puppies?
It all comes down to intensive supportive care. That's the entire focus. The goal is basically to keep the dog alive, keep their body functioning, manage the symptoms, prevent complications, and give their own immune system a fighting chance to eventually clear the virus.
And that requires hospitalization.
Almost always, yes. This kind of intensive care needs round-the-clock monitoring and treatments that just aren't feasible at home.
Okay, break down that supportive care. What are the key pieces?
The absolute cornerstone, #1 priority, is intravenous fluid therapy.
For fluids.
Because the vomiting and diarrhea cause profound dehydration and electrolyte imbalances. things like low potassium. They lose fluids faster than they could ever take them in by mouth, and even if they could drink, their damaged gut can't absorb it properly. 4V fluids are essential to rehydrate them, replace electrolytes, maintain blood pressure, and sometimes dextrose, which is sugar, is added if their blood sugar dropped too low.
Okay, fluids are critical. What else?
Nutritional support. This is really important too. We used to think resting the gut was best, but now we know getting some nutrition in helps the gut lining heal faster.
Even with the vomiting?
Well, we have to control the vomiting first, but then, yes. Sometimes this means placing a temporary feeding tube to bypass the stomach, or carefully starting tiny amounts of a bland, easily digestible food as soon as the vomiting is under control. Early feeding seems to improve outcomes.
Interesting. Okay, fluids, nutrition. What else?
Antibiotics, absolutely vital. Remember how the gut barrier breaks down, letting bacteria into the bloodstream?
Right, the sepsis risk.
Exactly. So antibiotics are given, usually IV, to prevent or treat that secondary bacterial infection, which can be deadly on its own, especially since the parvo has already weakened their immune system.
Makes sense. And you mentioned controlling the vomiting.
Yes, antiemetics. Potent anti-vomiting medications are crucial. They make the puppy feel better, reduce further fluid loss, and make it possible to eventually try offering water or food.
Are there other treatments sometimes used?
Yeah, depending on the severity, sometimes things like plasma transfusions are used if they've lost a lot of protein or to provide antibodies. And there's growing interest in fecal microbiota transplantation, basically giving them healthy gut bacteria from a donor, which some studies suggest might help restore gut health faster. Things like Tamiflu, which works for flu in people, haven't really panned out for parvo. But the core is fluids, nutrition, antibiotics, and anti-vomiting meds. Plus, of course, strict isolation procedures in the clinic.
That sounds like a huge amount of effort, round the clock, very intensive, and likely expensive, given how severe it is parvo usually fatal? Or is there real hope?
There is absolutely real hope, and this is important. While parvo is incredibly serious, with aggressive, appropriate supportive care like we just discussed, the survival rate is actually much, much higher than people might think.
Really? What kind of numbers are we talking?
In a hospital setting with intensive care, survival rates are often quoted as being between 70% and up to 90%, sometimes even a bit higher in specialized facilities.
Wow, 70 to 90%. That's way better than I would have guessed.
It is. But that's with treatment. Without treatment, the outlook is grim. Survival rates are often less than 10%, sometimes close to zero. It really highlights the importance of getting veterinary help immediately.
So getting them to the vet fast is literally life or death.
It truly is. Most deaths from parvo happen within the first 48 to 72 hours after the severe symptoms start. If a puppy can be supported through those first critical 3 to 4 days, their chances of pulling through improve dramatically.
And if they do make it through, how long does recovery usually take? When are they back to being playful puppies?
Dogs that survive usually start showing significant improvement within about a week of starting treatment. The typical hospital stay is often around 5 to 7 days, sometimes a bit longer if they had severe complications.
Okay, so they come home after about a week, tail wagging, ready to play, all clear.
Getting there. They'll still need some TLC at home, careful monitoring of their appetite, energy levels, making sure their stool is returning to normal. But the really important thing to remember is they can still be contagious.
Still shedding the virus, even after they feel better.
Yes. They can continue shedding the virus in their feces for about 2 to 4 weeks after their symptoms are completely gone. So even though they look recovered, strict isolation from other dogs is crucial during that period to prevent spreading it. No dog parks, no visits with puppy friends just yet.
Okay, 2-4 weeks isolation post-recovery. Got it. What about long-term immunity? Can they get parvo again?
Generally, no. Dogs that recover from a natural parvo infection usually develop very strong, likely lifelong immunity to the specific strain that infected them. That's one significant silver lining after such a scary experience.
Lifelong immunity is good, but obviously we'd much rather avoid the whole thing. So let's talk prevention. How do we stop this from happening in the first place? What's the ultimate defense?
Prevention, absolutely.
Yeah.
And the single most effective tool we have, hands down, is vaccination.
The parvo shot.
Yes. The Canine Parvo Virus vaccine is considered a core vaccine. That means veterinary experts recommend it for every single dog, regardless of lifestyle or breed.
Okay, let's revisit those puppy shots. We talked about the series because of mom's antibodies interfering. Can you just lay out the typical schedule again for someone with a new puppy?
Sure. Because of that window of susceptibility, puppies need a series. The first shot is typically given around 6 to 8 weeks of age. Then they need booster shots every 2 to 4 weeks after that, continuing until they're at least 16 weeks old.
At least 16 weeks.
At least. And in some situations, like with those higher-risk breeds we mentioned, or if there's a known high risk of parvo in the local environment, the vet might even recommend one more booster after 16 weeks, maybe around 18 or 20 weeks, just for extra insurance. Completing the entire series on schedule is absolutely vital. A couple of shots just isn't enough protection for a puppy.
Right. And what about adult dogs? Once they're past the puppy stage, are they good?
No, they need boosters too, just not as often. The standard recommendation is a booster vaccine 1 year after completing the puppy series. After that 1-year booster, subsequent boosters are typically recommended every 3 years for parvo.
Every 3 years for adults.
Generally, yes. Though the exact frequency might vary slightly based on the specific vaccine used, local regulations, or your vet's assessment of your dog's individual risk. But the bottom line is, keeping those boosters up to date throughout their adult life remains important.
Okay, vaccination is number one. What else can people do, especially maybe while their puppy is still going through that initial vaccine series and isn't fully protected yet?
Hygiene and smart management are key, especially knowing how incredibly hardy this virus is.
Right, it sticks around. So cleaning.
Yes, disinfection is important. If you need to clean indoor surfaces, bowls, crates, hard toys that might have been contaminated, first clean off any visible organic matter, like dirt or poop. Then, a dilute bleach solution, usually recommended at a 1.30 ratio, so 1 part bleach to 30 parts water, is very effective at killing the virus. Let it sit for about 10 minutes before rinsing. There are also specific veterinary-grade disinfectants that work well.
What about outdoors? Yards, parks?
Outdoors is much trickier. You can't really effectively disinfect soil or grass.
Yeah.
Time, dilution from rain or watering, and exposure to sunlight will gradually reduce the amount of virus over months, but it's not a quick fix.
So if you can't easily clean outdoors, what's the strategy?
Avoidance, especially for young puppies. Until your puppy has finished their entire vaccine series and had a couple of weeks for that last shot to take full effect, so usually after 16, 18 weeks old, be really careful about where you take them. Avoid high-traffic dog areas. Dog parks are a big one. Pet store floors where lots of unknown dogs walk. Public rest stops along highways. Communal grassy areas in apartment complexes. Basically anywhere that unvaccinated or potentially sick dogs might have been recently.
But puppies need socialization, right?
They absolutely do. It's crucial. But prioritize safe socialization. Interactions with known, healthy, fully vaccinated adult dogs in a controlled environment, like your own clean backyard or inside a friend's house where you know the dogs are healthy and vaccinated. Puppy classes can be okay if the facility has strict vaccination and cleaning protocols, but talk to your vet about the local risk.
Makes sense. What else on the hygiene front?
Waste management. Always, always pick up your dog's poop immediately, both at home and out in public. Even if your dog seems fine, prompt cleanup minimizes environmental contamination if they happen to be shedding unexpectedly. And personal hygiene. Think about where you've been. If you visited a shelter, a dog park, or even the vet clinic lobby, the virus could be on your shoes or clothes. Consider changing clothes and cleaning your shoes before interacting with your unvaccinated puppy.
That full picture vaccine, careful cleaning, smart avoidance, picking up poop really drives home how you have to be proactive against this tough virus. When you think about prevention overall, what's maybe the single most critical thing for our listener to take away?
For me, it really comes down to two things. The power of vaccination, especially that complete puppy series, and awareness of the virus's tenacity in the environment. The vaccines are incredibly effective at preventing severe disease and death. They shift the odds dramatically in your dog's favor, and understanding just how long parvo can survive out there really underscores why being cautious with young puppies is so important, and why keeping up with boosters matters even for adult dogs. It's a small investment compared to the potential devastation of the disease.
This has been a fantastic deep dive. We've gone from understanding this really sneaky virus and how it attacks a dog's body to recognizing those alarming signs, learning about the intensive supportive care vets provide, and crucially, how effective prevention through vaccination and careful hygiene can be.
It's a lot to cover, but hopefully really useful information. And we absolutely have to say this again very clearly. Everything we've discussed here is for educational purposes. It's meant to help you understand parvo better. But it is not a substitute for professional veterinary care. If you suspect your dog is sick, if you see any of those signs, or have any health concerns about your pet, please contact a certified veterinarian immediately. Don't wait. Your vet is the only one who can properly diagnose and treat your dog.
Couldn't agree more. Always consult your vet. And maybe a final thought for you, the listener, to chew on. We talked about how incredibly long this virus can survive in the environment, months, maybe even a year or more. Think about that next time you're on a walk. Every patch of grass, every sidewalk square your dog sniffs. It could potentially harbor this virus from a dog that was there weeks or months ago. It really hammers home why those regular vaccine boosters are so important, even for your seemingly healthy adult dog, and why community-wide vaccination helps protect everyone. That environmental persistence just underscores the need for constant vigilance.